I'll call upon Dr. Rahil Chaudhary. He'll be talking on silk versus contoura, what to choose. Rahil, please.
Thank you, Rohit sir, Namrata ma'am, AIOS, ISRS for inviting me to this wonderful conference. So I'm talking about a new technology, a new name that is creating a lot of buzz in refractive arena, which is by the name of silk. And a lot of doctors are asking this question, if silk is actually an upgrade or is it just an hype, an old wine in new bottle? So let us understand more about silk. So until 2023, we had some popular options in refractive surgery. Some of them were flap-based options like customized LASIK or contoura. Then you had flap-less options like SMILE being the most popular. And then you had surface ablative options like PRK or Streamlight, or otherwise very popularly known as epicontoura also. And now in 2024, we have another name or another machine or another technology coming in by the name of silk, which is basically a second generation femtosecond lenticule extraction procedure refractive surgery by Johnson & Johnson. And the question that is coming now is that, is there a need to upgrade when we already have extraordinary technologies like contoura and SMILE with us? Do we really need to upgrade to another platform in 2024? So let us first understand, how does contoura and silk compare? So over the times we've realized that 5 to 10% of the patients really get the contoura advantage. The remaining 90% of the patients have minimal higher order abrasions or irregularities. And even if you do a contoura treatment for them, the results are almost similar to an wavefront optimized treatment. So we understand that a careful pre-op evaluation is necessary, and only 5 to 10% patients would actually need a contoura advantage. So the rest 90%, let them have a flapless advantage. So again, what I was telling, what is contoura? It is a topo-guided LASIK correction approved for virgin eyes. Minimal number of patients really get advantage, the visual excellence from contoura, and let the other 90% get the flapless advantage. And then we have SMILE, which has been popular for so many years now. And now we have silk coming in with the second generation femtosecond platform. How do these two compare? And why is there a need now for contoura and SMILE users to upgrade to silk? Is there an actual silk advantage to it? Let us understand that. Well, the first advantage is, as the name suggests, that it is as smooth as silk. So never seen before such beautiful dissection-less extraction procedures. So just showing you one quick video. And why is it actually called silk? So open up the anterior plane, open up the posterior plane, and then when you to put any effort, there is virtually no resistance. It is something like slipping your instrument in the interface and it's done. And now I'm going below the plane. It just comes out like wow. This is the beauty of silk. It is virtually dissectionless. What is the second advantage? For the first time, we have something called as bridge-less laser spots. And this is the reason why the dissection becomes so smooth, because now your spots are actually touching each other with 1 micron spacing, and you have amazing quality of dissections. And I want to show you here and emphasize here, 0% of cases required significant dissection, or they were actually 0% cases which were difficulty to remove the lenticule. What is the next advantage? The third advantage, the advantage of the lowest energy possible. So I've put a picture here where I've compared the latest femtosecond platforms available, and you can see here that Elita or the Silk machine is working at a minimal energy of 40 to 90 nanojoules. Now what is the advantage of working at such low energy? The collateral tissue damage is minimal, and the first day post of wow is amazing. So we actually have patients next day, most of the patients 6/6 with a wow factor. Then what is the fourth advantage? The advantage of first in industry biconvex lenticule with Silk. So how does it benefit? So I've copied this picture from Rohit sir's presentation. Sorry sir, I could not click this. I don't know which OCT is this. So this has just been copied from Rohit sir's presentation. And what we understand here is that when you make a biconvex lenticule, it mimics the natural anatomy of the eye or the cornea. And you have better depth of focus. So we say that the depth of focus is almost comparable to an e-metrope patient with natural quality of vision, minimal change in Q value and spherical aberrations. So this is the fourth advantage of Silk. Let us see the fifth advantage of Silk. The fifth advantage of Silk is the fastest nerve regeneration. Again copied from Rohit sir's presentation. So this is the work done by Rohit sir and team Narayan Nitrale, and extraordinary results. And you can just see here 1 month, 3 months, 6 months how the nerves are regenerating. And this is the reason why patients have highly reduced dry eyes. Let's look at the sixth advantage. Fastest vision recovery, and I'm giving you honest figures here. People may claim that they get 100% patient 6/6 the next day, but no lenticle extraction procedure can give you 100% 6/6 the next day. But the highest number that we're attaining is with Silk. So we almost see 89 to 90% of the patients 6/6 next day with the wow factor, and 0% of patients lost any of the visual acuity lines. Let us see what is the seventh advantage. 100% satisfaction done in a study. So I think it is high time that when we have technology, we should upgrade and give our patients the advantage of the latest tech available. Thank you.
Any questions for, yes please.
We'll take the questions.
Yeah.
So Dr. Rahil, you said that contoura is needed only for 5 to 10% of patients. So Silk has been recently launched, but Smile and everything was there. So were you doing contoura only for 5 to 10% of your patients?
Yes. So initially what we were doing was that contoura has been approved for virgin eyes, normal corneas with minimal irregularities. And the idea was that when you correct these irregularities, you are able to give a visual excellence advantage to the patients. But over the time, doing so many conturas over the years, what we've realized is that only 5 or maximum 10% would really get that supervision advantage. Other patients, the results are comparable to wavefront optimism.
So exactly that is what is my point. Silk has been launched recently, and we are all gaga for Silk, that Silk is doing very well. Because when contoura was launched, this was the same thing for contoura, that contoura is the best possible treatment. And now on this platform, we are discussing that contoura is beneficial only for 5 to 10% of people.
Because you see, if the other 90% of the patients are getting the same vision quality with contoura or Silk, then why unnecessarily create a flap on the eyes?
Monica, if I can answer a little bit on that, it's like, see, ECC also gives the same 6/6, and people are very good at the extracapsular surgeries. But why did we move on to SICS and why did we move on to submicron is if you are able to give the same results of an extracapsular surgery with minimal invasion of a corneal tissue, that's what we call it as an advantage. In refractive surgery, if you look at the genesis of refractive or cataract surgery, it's all about, if you are giving the same safety as you are doing it with the contoura, with minimal thing and with minimal damage to the corneal nerve, with minimal changes in it. So that is what we should take it as a leap in it. So like I said, the comparison is a thief of joy. I mean, we do Silk, we do Smile, we do contoura, but the issue is that how beautifully you can take out power with least amount of collateral damage. And that is what I would say all this technology, whether it's Smile with faster thing or DETOS, or everybody has that advantage of it. That's how we have to take it in.
Rohit, just to add to that point, though, I have to say that, just to your question, she's right, because at the end of the day, the golden standard for this would be an RCT comparing contoura to a lenticle procedure. So even though, even though, of course, we will do I do a lot of lenticle extraction. It's not that I don't do any LASIK at all, and in fact, all the LASIK I do is basically contoura-based or topography-based. But the definitive answer to that question is to basically do a proper RCT with one eye topography-based versus a lenticle procedure, because that will give you the question. Because you're saying about doing these kind of lenticle procedures because of other advantages, dry eye, ocular surface, and things like that, which we all basically believe in as well. But to answer the specific effect of procedure versus specific procedure, that's the evidence. And the evidence, to be frank, from first-generation lenticle procedures against topography-based systems actually is in favor of topography-based systems. Now what you're seeing is from all the technology, there are second-generation procedures which should improve their outcomes. So that will hopefully, basically, somebody will do a study. I mean, everyone has LASIK machines, so maybe somebody here will do the study to answer that question.
Thank you.